Hello, everyone, and welcome to Medical Insurance and Coding. I'm your instructor, Stacy Feather. We're going to go ahead and get started. First of all, in this course, we're going to start out by looking at who pays for healthcare. The government, which has benefit programs of Medicare and Medicaid, the employer, and the patient. All three both pay for healthcare, depending on the situation. Secondly, we're going to look at the basics of medical insurance. These are going to be 5 terms that we're going to discuss in this course. You're going to hear these a lot. You're going to hear copay, deductible, coinsurance, out-of-pocket, and premium. Now, first of all, copay is something that most patients have. So you're going to see this quite often in your field. These are going to be located on the patient's insurance card. I don't know if any of you have insurance, but if you want to, you can actually look at your insurance card and see for yourself if you have a copay. A lot of times copays vary depending on the facility. Sometimes if they are going to the emergency room, sometimes the emergency room visit copay is going to be either more or less than, let's say, a specialty office visit or just a family physician. So that's something you're going to have to look at on the patient's insurance card during check-in to see if they have a copay and how much it is. Now, depending on your policy of the place that you work, they might require copays to be paid up front, or they may require them at checkout, or they may not require them to be paid for upfront at all. I have not ran into a facility yet that does not require copays to be paid up front yet. However, sometimes you still might run across those. Secondly is a deductible. This is actually a set amount that the insurance company, and once again, this can vary from patient to patient depending on what insurance plan they have. But a deductible is the basics of the insurance company sets a set fund, a set amount. Let's say it might be $500, and that patient has to pay that $500 out of pocket before any insurance benefits kick in. Now, a coinsurance, that's the second part of the insurance that the patient is going to be responsible for. So let's say, for instance, a patient comes in and they have what I like to call an 80-20 plan. 80% insurance, 20% is going to be the patient. Now, a coinsurance, that would be the 20%. The coinsurance is whatever is left over that the insurance did not pay. Out of pocket, this is also another set amount set by the insurance company depending on what policy or eligibility the patient has. The out-of-pocket is a set amount that the patient must meet before 100% worth of insurance benefits kick in. They can be $500 or it can be $1,000 or $5,000 depending on what insurance plan the patient has. Once they meet that out-of-pocket, the insurance company will then kick in and pay the full 100%. Now, finally, we're going to talk about premium. Premium works the same way as if it was a premium for a car insurance. This is the set amount depending on the employer or any other factors that may key into it. This is the amount that the patient must pay every month, depending on if they're taking it out of their paycheck, every 2 weeks, once a month, whatever the case may be. This is the amount of money that the patient must pay to keep the insurance current. It's always a good idea to double check when you call insurance companies to verify benefits that the patient has paid their premium and that the insurance is still active. Next, we're going to talk about health maintenance organization, an HMO, or a preferred provider organization, or a PPO. In this field, you're going to hear a lot of HMOs and PPOs. HMO is what we like to call the whole package. Getting into in-network and out-of-network benefits, depending on the patient and what policy the patient has, there's a certain criteria called in-network and out-of-network benefits. Now, in-network benefits is something that it's a contract that a lot of physicians and hospitals take up and pick up with different insurance companies. So if my health insurance company has a contract with a doctor's office that I go to frequently, I'm going to receive different fees and different benefits because I'm choosing to go to an in-network facility. The difference between an HMO and a PPO is there are more HMO policies out there. They're a little more expensive, both for you or the employer, sometimes both, but they do offer a more wider variety of in-network facilities. In the same way as the PPO, it's just a little less strict. They don't have as many options out there, as many in-network facilities that you might want to go to. Finally, we're going to talk about the medical billing cycle. In this section, there's 4 steps. Step 1 is you're going to pre-register the patient. When the patient comes into the doctor's office, you're going to give them what we like to call a demographics page. This page fills out all of their medical information, all their personal information, their name, address, phone number, next of kin, spouse information. Second, you're going to establish their financial responsibility. This is going to be where you ask for their insurance information. You're going to get all their information into the computer. Now, if they happen not to be the main policyholder on the insurance card, you're going to have to ask to see some information for the main policyholder. So, for instance, if I would go to the doctor's office and I'm on my husband's policy, I'm going to have to bring my husband's name, date of birth, and social security number with me to the doctor's office. That way I can bill the insurance. Step 3 is you're going to finish checking in the patient. You're going to take all of their information, everything that they gave you on their demographics page and everything they gave you on their health insurance. You're also going to scan into the computer informed and consent forms. That is consent to be seen and also financial responsibility, which the patient is signing a consent for you to send that information or bill that information to the insurance company. Once you check in the patient, the medical assistant will come out, get the patient, take them to a room. The doctor will come in, see them, diagnose them if any prescriptions need to be refilled, any blood draws, anything like that. The medical assistants will go ahead and take care of that. When they are all done with the patient in the back, once all questions have been answered, the medical assistant will actually let you know that the patient's ready to be checked out. The patient will come out and you'll check out the patient. That is in regards to them paying their copay possible. If they haven't paid it at check-in, you might have to reschedule them for a follow-up or possibly do a referral, depending on the situation. Now, the last part of this lecture, we're going to talk a little bit about deductible math. Now, sometimes in a doctor's office, when we talked a little bit about coinsurances and copays, sometimes your facility requires the patient to pay both their copay and their coinsurance up front. Now, sometimes it can be a little difficult to figure out, but it can be done. This is where I like to come into deductible math. Now, regardless, no matter if the deductible's been met or the out-of-pocket's been met, the copay still has to be paid.